Hello and welcome everyone. This is the Quarantine Life, and today I really want to have a look at how the USA is handling the coronavirus pandemic and what really went wrong. So, as you may have heard in the news recently, the USA is now the epicenter of the coronavirus pandemic. It is now leading the world in the total number of cases at over 100,000 people infected, with over 1,500 deaths. So I just want you to stop for a second and think about, how did we get here? Just to give you some perspective, look how big the United States is in comparison to Australia. In actual fact, the United States is larger than Australia by approximately 2 million square kilometers. It's not just one of the largest countries in the world, it's also one of the most populous countries in the world, ranked third behind China and India with around 331 million people. Within the United States, there are 50 states with differing levels of state rights and demographics. And to compare it to somewhere like Australia, which only has 7 states, you can already see that it would be a massive task coordinating a response to a viral outbreak such as coronavirus. Here's a look at the main cities by population in the United States. You could imagine that if there was an outbreak in a city with a population of over 8 million people, like New York City, it could potentially be a massive problem. The unfortunate thing, though, is that there is actually a massive outbreak going on in the state of New York, which New York City resides in. Also, the state with the second largest city, Los Angeles, is the third largest total case group for coronavirus. This is going to be an enormous problem going forward. I think it's really important to understand that the coronavirus is not just the flu. Those who are admitted to hospital for seasonal flu have an average stay of around 5 to 6 days. The incubation period is around 2 to 4 days. The death rate is only around 0.1% in the USA. And most importantly, it's a known virus and there are vaccines available. In comparison to the seasonal flu, with the coronavirus, 20% of patients are serious enough to be sent to the hospital. Within the hospital, the average stay is around 11 days, 5 to 6 days longer than the seasonal flu. Continuing, the death rate is between 2 to 5%. The incubation period, it's around 5 days with a maximum of 10 to 11 days. Basically, that means you can have the coronavirus and be spreading it for 5 to 11 days without even knowing it, and without even showing symptoms. Also, there is no coronavirus season, as it is simultaneously occurring in both winter and summer across the globe. However, the most important part to take away is that it's a novel virus. It is unresearched and there is no vaccine. And just a quick word on vaccines, they can take years to develop and safely test. Looking at the total corona cases in the United States now, you can see the United States is experiencing exponential growth. For those who don't know what exponential growth is, it's basically where the growth rate becomes ever more rapid in proportion to the growing total number or size. In order to understand how the coronavirus became so prevalent in the United States, we need to take a look at the United States coronavirus timeline. On January the 21st, 2020, there was the first confirmed case. By February 29th, the United States had their first death. March 2nd, US cases topped 100, rising to 1,000 on March 11th. It wasn't until March the 13th that Trump declared a national emergency. By March 18th, US cases had topped 10,000. And now, as of recording this video, just 10 days later, the US cases have eclipsed 100,000 with 1,700 deaths. And with all that information behind us, we can now look at the juicy stuff, and can finally have a look at what exactly went wrong. First, we start off with the team in charge, and those who are responsible with dealing with the pandemic in the United States, the Trump administration. A bit of context before going forward. In 2016, Obama created the Pandemic Preparedness Office after the Ebola epidemic. In May 2018, President Donald Trump's Biodefense Preparedness Advisor warned that a flu pandemic was the country's #1 health security threat, and that the US was not prepared. There appears to be a lot of conflicting reports of what actually happened to the pandemic response team, but ultimately, in 2018, the staff that were involved in a pandemic response were either fired, relocated to a different department, or left the administration altogether. These staffers had an intimate knowledge of epidemiology and constantly monitored a range of global health threats. The really bad thing, though, is that they were never replaced until just recently. Moving forward, though, we need to talk about the Center of Disease Control, otherwise known as the CDC. The CDC is responsible for preventing, detecting, and responding to the spread of diseases in America. Leaked internal emails show just how chaotic it was behind the scenes at the CDC, and how much they underestimated the threat of coronavirus in the United States, even as it was gaining a foothold. Basically, the emails showed that the director of the CDC was downplaying the risk to the general American public in the early days, and they were having difficulty keeping track of Americans who had the coronavirus. There was also confusion on which testing criteria to use. It was a whole mess. Now, let's have a look at the leader of the Trump administration, President Donald Trump. Since we now have an understanding of how coronavirus propagated through the United States, we should look at Trump's responses during that period. Here I have taken some quotes over the time used by Trump to demonstrate his understanding and response during this time. I don't want to read each quote, but I think it's much better demonstrated in a video by recount.com, which I'll play next.
We have it totally under control. It's one person coming in from China.
We think we have it very well under control. We pretty much shut it down coming in from China.
You know, in April, supposedly it dies with the hotter weather. When it gets warm, historically that has been able to kill the virus.
People are getting better. They're all getting better.
And the 15 within a couple of days is going to be down to close to zero.
It's going to disappear. One day it's like a miracle. It will disappear.
And you'll be fine. They're going to have vaccines, I think, relatively soon. Not only the vaccines, but the therapies. Therapies is sort of another word for cure.
We're talking about very small numbers in the United States.
Our numbers are lower than just about anybody.
It's really working out, and a lot of good things are going to happen.
And we are responding with great speed and professionalism. It's going to go away.
Yeah, no, I don't take responsibility at all.
We're going to all be great. We're going to be so good. This came up, we came up so suddenly.
This is a pandemic. I felt it was a pandemic long before it was called a pandemic. All you had to do is look at other countries.
Before continuing, I'd like to do a thought experiment. If your car broke down, for example, would you go to a crystal healer or a mechanic? If you had to sit a science exam, would you go to a scientist or an accountant for help? I think you know where I'm going with this, but if you have to deal with a national health crisis or a pandemic, would you go to Donald Trump or health experts? The Reddit user Popping Cream beautifully summed up reasons why people should not take healthcare advice from Trump. I think it's important to briefly go through each of these statements. Firstly, President Trump believes that the human body has a finite amount of energy, like a battery, and that exercising will kill you. Secondly, the president was once an ardent anti-vaxxer. He believed doctors pumped kids full of vaccines that caused autism. Thirdly, President Trump believes the sound from wind turbines can cause cancer. And fourth, he mocked concussed athletes and the NFL's handling of brain injuries, basically downplaying CTE, or chronic traumatic encephalopathy. Even at a recent press conference, President Trump falsely claimed that the FDA approved a malaria drug known as chloroquine to treat patients with Covid-19. Essentially, a man died, and his wife is in a critical condition after they consumed fish tank cleaner because they wrongly assumed that the chloroquine in the cleaner was the same thing as the malaria drug. It's a psychological phenomenon where basically the more you know, you suddenly realize you don't know anything, because the deeper you look, there's actually so much more to learn. This is called the Dunning-Kruger effect. The Dunning-Kruger effect is a cognitive bias, and people who are incompetent at something are unable to recognize their own incompetence. And not only do they fail to recognize their incompetence, they're also likely to feel confident that they are actually competent. How does this relate to Donald Trump?
Basically, by using the Dunning-Kruger effect, we can show that Trump's inexperience and lack of knowledge, even regarding the fundamentals of science, puts him here, whereas his confidence in everything, including science, actually shows his lack of competence.
Going forward though, an article by Mika Zenko makes some great points regarding Trump's leadership. Firstly, no matter how ill-informed or inaccurate of something, Trump remains completely anchored to his initial impression or judgment. Secondly, Trump's judgments are highly transmissible, and they infect the thinking and behavior of nearly every official or advisor who comes in contact with him. And this is why he surrounds himself with people who look, think, and act like he does. Thirdly, the poor judgments soon contaminate all the policy-making arms of the government with almost no resistance or even reasonable questioning. In essence, he's made an echo chamber for his administration, where those who agree with him stay, and those who don't are forced to leave, including those who may be most adept at whatever situation arises, such as the coronavirus pandemic. Perhaps one of the greatest problems that the US faced in preventing the spread of the coronavirus in the early stages was that the Trump administration declined to use the World Health Organization's coronavirus testing kits. In fact, by the end of February, the World Health Organization had shipped testing kits to nearly 60 countries, and the United States was not one of them. Unfortunately, what this led to was that many cases of coronavirus were being undetected, and thus perpetuating the spread, either overtly or silently. Additionally, what this meant was that there was actually a massive amount of underreporting in the early days, and this contributed to the spread of coronavirus in the United States. To show you how poor the early testing was in the United States for coronavirus, by the 9th of March of 2020, only a bit over 4,000 people had been tested for the coronavirus nationwide. And the thing is, this is almost 2 months since the first confirmed case in the United States had appeared. In fact, by March 16th, the United States had the lowest testing rates per capita of any country affected by coronavirus. In the United States, with a population of around 330 million, they had only tested roughly 11,000 people, whereas South Korea, a country with 51 million, was testing nearly 20,000 people per day. It's also interesting to note that the two countries announced their first known cases of coronavirus just hours apart. However, on the 25th of March, Donald Trump tweeted that they had done more testing than other nations. And I don't really know why testing is in quotations, but it is. But looking a bit deeper at the stats, as of the 24th of March, a bit over 348,000 South Koreans had been tested, with around 9,000 being confirmed to have the virus. Before moving on, I want to point out that unfortunately the CDC does not put up updated aggregated counts of tests in public and private labs. However, the majority of them are done in commercial and not government-run labs. And just to point out how crazy this is that the only place to currently get the levels of testing is to look at the COVID tracking project, which does not get its information directly from the government, but by things like state and territory public health authorities, trusted websites, tweets, and Facebook updates, which are then collated, analyzed, and published. As already mentioned, although both countries reported their first cases of coronavirus on the same day, South Korea's testing rate is already 6 times higher than the test rate in the US. So far, the US test rate is about 1,000 tests per million, and South Korea's is 6,700 tests per million. And you can already see what this early testing did. Firstly, it allowed the accurate identification and tracking of those infected with the coronavirus, and secondly, it slowed the spread. With America, because there was so little tests done during the initial stages, there was a lag to the exponential curve. And importantly, just because this graph is flat for a very long time compared to Korea's, it doesn't mean that people just magically got sick here. What it means is that people were sick this whole time, they just weren't being tested. And unfortunately what this means is that this exponential curve is going to keep rising for longer than it did in Korea.
Thanks for watching part 1, guys. Smash that like and subscribe button with your elbow so you won't miss out on part 2 coming out in a few days. Most of all, as we always say, wash your hands.